So conservatives hate Medicare. What are they offering as an alternative? This gets pretty weird. Check it out. Leave your comments, ding the bell, share it with your friends, and subscribe to our channel. On the line with us right now is Dr. Scott Barbour. He is a board-certified orthopedic surgeon, a fellow of the American Academy of Orthopedic Surgery, and advisor to the Job Creators Network Foundation's Healthcare for You plan. Their website, jobcreatorsnetwork.com. The Twitter handle is Job Creators USA. Dr. Barbour, welcome to the program.
Thanks for having me on. I appreciate it.
My pleasure. So you guys are pitching this new, quote, personalized healthcare, end quote, frame. And what I don't understand is why do you hang so tenaciously to the idea that we should be paying for-profit corporations and the billionaires who own them money to insert themselves essentially as bankers into the middle of our healthcare decisions? You know, you've got Dollar Bill McGuire, the former CEO of United Healthcare, the largest of the health insurance companies, took $1.6 billion in compensation. Every penny of it by saying to somebody, no, you can't have that operation, or no, we're not going to pay for that treatment because you have a pre-existing condition or whatever. You know, the guy who followed him, Stephen J. Hemsley, took something close to $1 billion out of that company. They've got a new CEO. I mean, you've got over 100 people there who are making over $1 million a year. Why in God's name do we have to be passing all of our health care money, or so much, you know, about 20% of our health care money, to these corrupt for-profit health insurance companies so that they can run this so-called personalized health care?
Well, I think you're conflating our program with something that we completely opposed. I mean, you and I are on the same page. I'm absolutely opposed to what we call big medicine, which are these conglomerates of insurance companies and hospital systems that are gouging the American people.
Your program is supporting for-profit health insurance companies.
Our system was based on inputs from job creators, from doctors.
Wait a minute. Job creators? You're talking billionaires?
No, I'm talking people who are small business owners like myself. I'm not a billionaire. I have about 100 employees. I run an orthopedic practice, and healthcare is one of my most...
Okay, well, historically, when we've talked to people from the Job Creators Network, their main pitch has been that billionaires, people like, you know, Bill Gates and Zuckerberg, you know, that they're job creators. That's why we should love them. So,
no,
but in any case, I interrupted you. Finish your riff.
Yeah, what we're talking about here is small business owners who actually are forced to provide health care for patients and for their employees. And what we want to do is get employers out of the healthcare industry, and we want to make doctors and patients put back in control of their own healthcare decisions. What we want to do is get bureaucrats, whether they're from an insurance company or from the government, out of the decision-making process. And we came up with a system based on research involving over 25,000 patients, including Republicans, Democrats, and independents, that told us what we want. We talked to doctors about what actually will work, people who actually have to deliver this health care on a day-to-day basis, and small business owners, 30% of which have dropped their health care because it's gotten so expensive over the last decade. So our system is primarily based on reestablishing the doctor-patient relationship and getting rid of some of these perverse incentives that currently exist under the current system. Over the last decade, we've had about 53% of doctors become employed now. And so rather than a doctor's fidelity being to the patient that they're treating, it's to the hospital system that employs them. The hospital system puts on perverse incentives, like if a doctor discharges a patient and readmits them within 30 days, the physician is dinged and their reimbursement goes down. And so you're creating this barrier between doctors and patients that didn't used to exist. What we want to do is reestablish that relationship. And part of that is going to be accomplished by restoring price transparency, which allows patients to pay for only the health care that they use. Under the current system, we want to get rid of the essential health benefit, which is a one-size-fits-all healthcare system that doesn't give patients any choices. The combination of increasing choice, expanding the ability for direct medical care, and price transparency will allow...
This is sounding like a word cloud to me. Who pays the bills?
The patients pay the bill.
Okay,
just
so
like
I'm
they do
supposed to now pay for my own health care. What happens if I get cancer and I can't afford to pay for it?
That's what insurance is for, and that's what we need to do.
So
is get
insurance pays the bill. So we're back to for-profit insurance companies.
Hey, listen, if you're talking about a system where somebody's going to pay the bill that's not the patient, you're mistaken. Right now, under the system that we've currently had over the last decade, the government has become more and more intrusive, and family
intrusive? It's intrusive if I buy Obamacare and they pay my bills?
What's that?
Here's my question, Dr. Barbour. There's this group of the 34 largest countries economically, the 34 largest countries in the world. It's called the Organization for Economic Cooperation and Development, the OECD countries. We are the largest of the OECD countries. The smallest is Costa Rica. Of those 34 countries, 33 of them provide universal health care. They do it in different ways. In Switzerland, for example, it's not a single-payer program. It's a whole bunch of small companies, but they all are required by law to be nonprofit, and their CEOs can't make more than what would be the equivalent of maybe $250,000 a year here in the United States. But that's the closest to a privatized system among the OECD countries. Has any country, to the best of your knowledge, anywhere in the world put into place your system with success?
Well, this country has put it into practice with success better than anybody else. But the problems that we have in this country are due to too much government intrusion. Now, some of these countries that you're talking about, these industrialized nations with these fantastic health cares like the United Kingdom, where they have 4 million people waiting greater than 18 weeks for care, you got 250,000 of them waiting more than 6 months. Heck, we just saw Mick Jagger come to the United States to get his heart surgery. In Canada, you got 60,000 people leaving a year.
You know, we can play medicine by anecdote all day long. I mean, I can cite how many people are. You got 40,000 Americans dying every year because of lack of access to health care because of this program that you're saying you're building on and is a wonderful program. That's not happening in the United Kingdom. That's not happening in Canada. It's true according to Harvard University.
Listen. Are you going to believe your lying eyes or your statistics? People are leaving leaving Canada at the rate of 60,000 a year because they can't get that care in their own country.
I don't believe it.
You're not seeing that kind of exodus.
I do not believe it. I do not believe it.
Well, listen.
I lived in Vermont and I lived in Michigan. In both cases, I lived within 2 hours.
Listen, the real world.
Well, in the real world, I grew up in Michigan. I lived there until I was 27 years old. I ran 2 different businesses in Michigan. We lived in Vermont for a decade. In both cases, we were less than 2 hours from the Canadian border. I never, ever in my life saw a Canadian come to either one of those states looking for anything other than a meal. Now, on the other hand, when I lived in Montpelier, Vermont, every Saturday in downtown Montpelier, and I could see it from my living room window, buses would pull up and people would get on those buses to go to Canada to buy their pharmaceuticals, to get health care. We've got Americans right now leaving for Mexico to get dental care because dental care is insanely expensive in the United States because it's highly privatized, like you're suggesting. You've got Americans going to Thailand for orthopedic surgery, again, because, you guys in the orthopedic industry have turned this into a real cash cow, and most orthopedists are now, multimillionaires. I mean, I don't get how this works. Every other country in the world has figured out how to provide health care to everybody without some bankster in the middle becoming a billionaire, except the United States. And it sounds to me like you want to keep the banksters in the program.
Listen, that's just factually not true. Basically, everything you just said is factually not true. I've been practicing healthcare for 30 years, and I've seen it from the inside. I know what total government-run healthcare looks like. It looks like the Veterans Administration, where the only thing you can get is medicine and nobody gets any care. The government bureaucracy is so strong there, it denies care.
Veterans, the VA and TRICARE are the most highly rated healthcare systems in the country.
In the entire state of Georgia, and the insurance companies will prevent me from delivering basic care. I have to do a peer-to-peer review just to give an injection into the shoulder. This is ridiculous. It's rationing. the idea that a government-run healthcare system is effective is a joke. Our own current Medicare system, which only takes care of people 65 and over, already has significant premiums and deductibles, and it has gaps in coverage. And it's getting more and more.
I'm on Medicare, and I'm doing just fine. I even had back surgery 2 years ago on Medicare. They paid everything, every single penny of it. In fact,
it's already got trillions of dollars of unfunded liability, and if you have Medicare, then you know that it comes.
Then let's raise taxes on wealthy doctors like yourself so that we can all have Medicare.
Now, listen,
I shouldn't have personalized that. I'm sorry. My apologies.
Medicare as it exists is already broke, okay, and it has significant premiums and deductibles. That's a fact. Now you're talking about extending Medicare for every single person in the country and telling us that it's not going to cost anything.
No, I'm not saying it's not going to cost anything. It's going to cost our total cost. Why is it that
we're talking about $33 trillion over the next year, which is going to double our budget?
Right, but if we stay with private insurance like you're advocating, it'll be $39 trillion over the next decade, according to Charles Koch.
Well, Charles Koch doesn't speak for us.
Charles Koch's organization did an analysis, and they came up with that $33 trillion number that you're selectively quoting. That, yes, if you went to Medicare for all, it'll cost $33 trillion over the next 10 years. It's about $3 trillion a year. But right now, if you simply extend the program that we have right now, Charles Koch's group said it would be $39 trillion.
Listen, we know that historically speaking, those estimates are always very, very low. Okay,
so how are you going to save money when you're skimming 20% off the top for stockholders and CEOs?